Hi, I'm Dr. David Hess, and I'm a primary care physician in West Virginia, and have been practicing medicine now for nearly 20 years, seeing tens of thousands of adults and children in my career. My patients sometimes ask me if the COVID vaccines are safe. My answer is yes. COVID vaccines are safe. They were first evaluated in tens of thousands of people who volunteered to participate in clinical trials. These clinical trials followed the same thorough safety and efficacy standards that the FDA sets for all vaccines in the United States. Since then, millions of people in the United States and around the world have received COVID-19 vaccines, and the results from the U.S. and global safety monitoring efforts are excellent. There are rigorous systems in place to quickly identify any safety concerns and take action. These monitoring systems provide information that allows public health and medical experts to update the recommendations and guidelines as needed to ensure COVID-19 vaccination is safe. When it comes down to it, COVID-19 vaccines are safe and effective. Vaccinations save lives. That's why I chose to be vaccinated and why I recommend COVID-19 vaccination to my patients and my family. Thanks for tuning in. I'm Dr. David Hess. For more information about COVID-19 vaccines or to find a location near you, visit Vaccinate.wv.gov.
Hi, I'm Dr. Catherine Moffat. I'm a physician specializing in pediatric infectious diseases at West Virginia University. My patients and their caregivers sometimes ask me if children and adolescents can have side effects from COVID-19 vaccination. There can be side effects, although not everyone has them. The side effects that children 12 and up can experience are similar to those in adults. These tend to be mild to moderate and include soreness, redness, and swelling around the injection site, tiredness, headache, chills, fever, or nausea. These effects usually last only a few days, and kids may experience some or none of them. These side effects can be a sign that the immune system is building up its natural defenses against COVID-19, but many people build protection without these signs. Similar to adults, these effects are more common after the second dose, yet that second dose is essential for maximum protection. Although these side effects can occur, they are short-lived and outweighed by the benefits of being protected through vaccination. Many cases of COVID-19 among children and teens are mild, but even mild cases in children can lead to long-term health problems. I've cared for children with COVID-19. Some of their cases can be quite severe. In fact, COVID-19 was among the 10 most common causes of death in children in 2020. And COVID-19 hospitalization rates among teens increased in the spring of 2021. COVID-19 vaccination is a safe and effective way to protect our kids against the virus. It protects not only the person who's vaccinated, but those around them as well, especially children who cannot yet get vaccinated. This is why I recommend that my patients ages 12 and older get vaccinated, and I encourage patients, parents, and caregivers to discuss COVID-19 vaccination with a healthcare provider. Thanks for tuning in. I'm Dr. Catherine Moffat. For more information about COVID-19 vaccines, or to find a location near you, visit Vaccinate.wv.gov.
Back to school is almost here. Has your family been vaccinated for COVID-19? West Virginians 12 and older can get vaccinated, and it's the best protection from COVID-19. Protect yourself and your family by getting vaccinated today.
I'm Dr. Jenny Yost, a physician and women's health specialist in West Virginia. I have experience providing gynecologic care to adolescents and young women for over a decade. Are COVID-19 vaccines safe for people who want to have a baby soon or in the future? The answer is yes. COVID-19 vaccines are safe for people who are pregnant, as well as those who may want to become pregnant anytime in the future. There is no evidence that any vaccine, including COVID-19 vaccines, affects people's ability to get pregnant. In fact, leading women's health associations agree that COVID-19 vaccines do not impact fertility. When you get a COVID-19 vaccine, the process of building immunity occurs in the immune system and does not impact the reproductive system. The COVID-19 vaccines have undergone very rigorous safety monitoring. There is no reason to believe that the COVID-19 vaccines will have any impact on the ability to have a baby in the future. So yes, the vaccine is safe for individuals who want to become pregnant in the future. These are just a few reasons why I recommend COVID-19 vaccination to my patients. People who are pregnant or want to get pregnant in the future can choose to get vaccinated. Thanks for tuning in. I'm Dr. Jenny Yost. For more information about COVID-19 vaccines or to find a vaccination location near you, visit Vaccinate.wv.gov.
I'm Dr. Kara Willenberg, a physician and chief of infectious diseases at Marshall Health. You might be wondering, how do COVID mRNA vaccines such as the Pfizer and Moderna vaccines work? First, let's start with the ingredients. The mRNA vaccines are made of sugars, salts, lipids, and mRNA. The mRNA, or messenger RNA, tells our body how to make proteins. The COVID-19 mRNA vaccines teach our cells how to make copies of a spike protein that resembles the spike on the outside of the virus. Once our bodies create that spike protein, our immune systems are able to make antibodies. Antibodies can then recognize the virus if we come into contact with it and fight it off. The mRNA from the vaccine does not enter our cells where DNA is made, so it cannot affect our DNA. The mRNA breaks down and goes away quickly, leaving in its place the blueprint for protection. The COVID-19 vaccines boost our natural defenses against the virus. It takes our bodies about 2 weeks after the second dose of the mRNA vaccine to develop maximum protection. You cannot get COVID-19 from the vaccination. By choosing to get vaccinated, you are teaching your body how to defend itself from COVID-19. Vaccination is the safest path toward building a community of immunity. Thanks for tuning in. I'm Dr. Kara Willenberg, and I recommend COVID-19 vaccination to my patients, my family, and my friends. For more information about COVID-19 vaccines or to find a vaccination location near you, visit Vaccinate.wv.gov.
Hi, I'm Dr. Gilbert Goliath. I'm a pediatrician in Charleston, West Virginia. I've been practicing medicine for over 30 years. The parents and caregivers of my patients often ask if children and adolescents should get vaccinated against COVID-19. My answer is yes. As of June 2021, COVID-19 vaccines are available for individuals 12 years and older, and I recommend COVID-19 vaccination to my patients who are able to receive it. As a pediatrician,
Hello everyone, it's Friday, September the 10th. And as I told you, on Wednesday, I told you on Monday, I've told you over and over. We started out down the pathway. I think we had, I don't remember what it was, but 3 or 12 or whatever folks in West Virginia that had the Delta variant. We didn't seem terribly concerned and everything, but our health officials told me to be really concerned, and I was. I came to you and I told you that we really need to buckle up because this thing could absolutely run rampant all across our state. Well, it surely has. We've lost another 38 people since Wednesday. We're going to continue to lose people in this surge without any question, and it just brings a level of sadness over all of us. We offer up our prayers to all those, and our prayers to all of us that we'll just quickly now realize that going unvaccinated is really making a big mistake. Absolutely mandating, you to get your vaccination is something that I absolutely do not believe in. And with all that, I would just tell you just this. I'm going to continue to encourage you. We absolutely are having successes in the fact that, and let me just double check here, but hold tight with me just one second. We've had 4,800 people, 4,800 people that have been vaccinated since our last briefing on last Wednesday. 4,800 people have come in and have gotten their shots in the last 2 days. Of those 4,800 people, there's no question whatsoever, some of them that this move has saved their life or the life of a loved one or someone really close to them. We've had 1,142,000 West Virginians that have gotten vaccinated now, and we're up to 73.4% of our total eligible population that have gotten at least their first shot. But West Virginia still lags behind, and with all of that, 38 more people have died. 38 more people in this horrible lottery on who's going to get sick next, who's going to die next. 38 great West Virginians we've lost. So join me right now in paying our respects in every way we can. And like I said over and over, if you know these families or whatever, call them, go see them. Reach out a hand to where they don't feel alone. I absolutely pray in every way that these people won't become a number. But in all that, our 3,170th death is a 59-year-old male from Harrison County. The 3,171st death is a 67-year-old female from Preston County. The 3,172nd death is a 70-year-old male from Greenbrier County. The 3,173rd death is a 71-year-old female from Cabell County. The 3,174th death, a 52-year-old female from Marshall County. The 3,175th death, a 58-year-old female from Upshur County. The 3,176th death, a 65-year-old male from Wood County. The 3,177th death, a 69-year-old male from Kanawha County. The 3,178th death is a 72-year-old male from Tucker County. The 3,179th death, an 87-year-old female from Ohio County. The 3,180th death is a 73-year-old male from Preston County. The 3,181st death is a 63-year-old male from Marion County. The 3,182nd death is a 65-year-old male from Harrison County. The 3,183rd death is a 93-year-old female from Mercer County. The 3,184th death is a 59-year-old female from Kanawha County. The 3,185th death is a 64-year-old female from Marion County. The 3,186th death is a 65-year-old female from Mercer County. The 3,187th death is a 34-year-old male from Randolph County. 3,188th death is a 66-year-old male from Harrison County. 3,189th death is a 86-year-old female from Cabell County. 3,190th death is a 58-year-old male from Raleigh County. 3,191st death is a 75-year-old male from Kanawha County. The 3,192nd death is a 94-year-old female from Raleigh County. 3,193rd death is an 81-year-old male from Pleasants County. 3,194th death is an 81-year-old female from Barber County. 3,195th death is a 54-year-old male from Raleigh County. 3,196th death is a 33-year-old male from Kanawha County. 3,197th death is a 91-year-old male from Pleasants County. 3,198th death is a 73-year-old male from Barber County. 3,199th death is a 79-year-old male from Upshur County. The 3,200th death in West Virginia is a 70-year-old female from Lewis County. The 3,201st death is a 62-year-old male from Mercer County. The 3,202nd death is a 62-year-old male from Greenbrier County. The 3,203rd death is a 68-year-old male from Mingo County. The 3,204th death is a 69-year-old male from Wood County. The 3,205th death is a 72-year-old female from Marion County. The 3,206th death is a 55-year-old male from Cabell County. The 3,207th death in West Virginia is a 61-year-old male from Logan County. We can stop this, West Virginia. We can stop it. The vaccines are safe. The vaccines are not an invasion on anyone. Without any question, all across this land, growing up as kids and everything else, we got vaccines. We did them. We did them forever. These vaccines are incredibly safe, and they'll stop this. You got a real choice, West Virginia. And absolutely, with all in me, I pray in every way you'll listen to me, and more and more and more of you will get vaccinated. This thing is running rampant right now. There's no guarantee that we're close to the point in time when the surge is going to peak and we're going to go down. When is that point? Is there a guarantee that that's going to happen over the weekend, or it's going to happen a week from Saturday? Or is the guarantee really and truly that we're just in the beginning and maybe we won't peak until Halloween or Thanksgiving? And in all of that, how many more are going to die, and die a horrible death, a death where you can't breathe? I mean, how many of you are sitting on the sidelines and not running to get vaccinated today because you think, well, it won't happen to me? Or yet, you may think, well, I'm really busy today and I really just got so many things to do and I can't really get to it today. And I've said it over and over. We don't have any other tools in the tool chest. We don't have any other tools. absolutely, with all in us, this is all we've got to fight with right now. So absolutely, we've got to fight with just that, the vaccine. And if we absolutely turn our backs on this, more people die. That's all there is to it. With 2,379 new positive cases in the last 24 hours, our daily positivity rate 11.64. We now have 24,532 active cases. A bunch of them will die. We're at an all-time record for patients in the ICU, 252 patients in the ICU. All-time record. All-time record for patients on ventilators. 141 of them are on ventilators. For the most part, our entire state's red. We're now up to 51 of our 55 counties that have mask mandates for K through 12 or have some criteria that's requiring some type of mask. We have 4 counties. 4 counties. Those 4 counties are Putnam, Pocahontas, Ohio, and Mingo County that have not mandated their mask. This is a no-brainer too. Without any question whatsoever, we're going to end up with all 55 counties, and surely to goodness, the faster we get there, probably the better. I have tried with all in me to make it to where the local people, which I felt like had the best knowledge, the local people could make those decisions as to what is going to happen and what's going on in their schools. In doing so, 51 of our counties have moved that way. Now, without any question whatsoever, if we would have just gone in and mandated, which I don't believe in doing, if we had mandated on day one, oh, we're going to put masks on everybody in the schools, we would have had division across this state like you can't imagine. You know, I'm not in a contest as a popularity contest. I'm not in a contest to see that I can be more and more and more Republican or I can do things that will help both sides of the aisle and everything. What I'm in a contest to do is do what is right for West Virginia. I'm not in a contest of Republican or Democrat or Independent. I'm in a contest absolutely to do the right thing for West Virginia all the time. There's no question that we have an incredible high percentage of the folks that are in the hospitals are unvaccinated. You know, I remind you all the time, if you're 65 and older especially, and you get any kind of symptoms, go get tested. For God's sakes of living, these antibodies can save your life. I encourage you, if you're in a crowd of people, especially indoors, and you're in a big crowd of people and everything, and you don't have a mask on, you're probably making a big mistake. In fact, you know, well, I'll keep going here. I've already been through the number of people that we gave doses to in the last couple of days, and our percentages are growing. They're just not growing fast enough. Now, we had a good day yesterday. We gave away a couple of scholarships, you know, full ride scholarships to 2 beautiful young ladies. You know, at North Marion High School, you know, they really had quite a celebration there, and you know, in those counties and everything, Morgantown, you know, Monongalia County, Marion County, you know, we're wearing masks, and so that young lady right there is Hannah McIntyre, and Hannah won, you know, her full ride scholarship, and her parents were there, and it's really good stuff and everything. So, you know, the superintendent and the principal, you know, and all the kids that were, you know, out in the parking lot and everything, we did all this outside, and it was just a great celebration for a wonderful, wonderful young lady. Then we went to Morgantown High School, and Cameron Daniels, you know, won her scholarship there, and you know, her family was there and just really tickled. It really really beautiful young lady, and it was just a great, great day. And then we went to Fairmont State, and we gave away a souped up Chevrolet Camaro. We gave it to Karen Hoffert, and we gave Jason Creighton of Clarksburg was named the winner of the free gas for 10 years. We gave Angela Smallwood of Flemington was presented the keys to a brand new top-of-the-line zero-turn mower and called a Bad Boy Rebel mower. And then Cheryl Lothar was of Lost Creek was presented with the keys of a new Yamaha Wolverine UTV. And so all people, all younger people, and we were really happy to be able to do this. We thank Dr. Martin and all the folks at Fairmont State that are doing an incredible job. And all these people won a nice little prize and everything because they were vaccinated, they registered and everything. And every last one of them is saying, come on, just like myself and little baby dog, come on, we got to get vaccinated. That's just all there is to it. So, vaccine eligibility, again, 12 and older, the natural immunities. We're finding out more and more and more about natural immunities once people have had this, and we're now leaning more and more towards this natural immunity is truly is greatly beneficial, but at the same time, it is not going to hurt you in any way to go ahead and get vaccinated. And as we learn more, we'll learn more even from our experts today about the natural immunities, studies that have come out, and more studies coming out of Israel. Israel stays ahead of the whole world almost in all these categories, but we've paid close attention and want to continue to learn and move forward ourselves. But so from the standpoint of all that, I think Dr. Marshall will be talking to you about that. Again, we've got to get more and more young people to the finish line. I think we did that yesterday. We were able to be out in front of a lot of young people and really pushing them hard to go ahead and get vaccinated. And, those kids were great. I mean, really and truly, when it really boils right down to it, it was unbelievable, wonderful at Morgantown, but North Marion was just really something. The whole student body was outside, and hundreds of them came up and said hello or hello to baby dog or whatever it was and everything. But they really listened. Those kids were great. And so from the standpoint of everything that's going on in those counties, the superintendents we were able to meet with in both counties, from the standpoint of the principals of the schools, those people are doing amazing work, and really and truly. So we thank all the teachers, we thank all the service personnel, everybody that was connected with those schools, because they're doing great work. But more than anything, those kids were mannerly. They were just intent on listening as to what maybe could be a recommendation that they ought to do, and hopefully we'll get more and more and more of them across the finish line. From the standpoint of the booster shots, we still stand ready to go. I've got big time issues, with all the stuff that's going on with the Biden administration. It just seems like we just continue to stumble and fall and do everything under the sun. And, but we really need approval to be able to go with the booster shots. From the standpoint of leading the nation, we came right out of the gates. We did so in every way. We're the envy of the entire nation, and now we've got people that are 60 and older that are way past 6 months, many past 8 months that have been vaccinated. We need to be giving them the booster shots. All the stuff on free testing about, again, special thanks to Walgreens and Frith for all that they've done. We have now 72 outbreaks in our long-term care facilities and 4 outbreaks in our churches. That's Barber, Monroe, Raleigh, and Wayne counties. We have 159 inmates that are infected and 71 staff cases. You know, I encourage you again about giving blood, and I'm just going through the announcements, and you know, our grand families registration's open. We encourage you to get those kids in your households that are vaccinated and take advantage of this $150 school voucher. You know, I really think that our grand families play such an unbelievable role, you know, in our state. You know, 19,000 kids live with those folks, and so we salute them for all the great work that they do, but we ask them to step up here and help us a little more, and I know they can. You know, tomorrow is a really, really sacred day. Tomorrow marks 20 years since our towers came down, our attack on the Pentagon, attack, you know, from the standpoint that those people in that wonderful plane that crashed to the ground in Pennsylvania, you know, those people saved who knows how many thousands of lives, as that plane was probably headed right back and headed at our nation's capital or whatever it may be. You know, we'll have our flags at half-staff, and I ask you again for your prayers and us to never, ever forget that day. That day was a beautiful, quiet, blue sky day, and then all of a sudden, America was being attacked. And so many have suffered beyond belief. And you know, I ask that you'll please remember that day and all those that suffered and all those that continue to suffer. So today I'm signing a proclamation to lower our flags to half-staff from dawn to dusk tomorrow, September 11th, 2021. It's hard to imagine that it's been 20 years. You know, time just moves along. But with that, you know, I have also issued a proclamation officially declaring tomorrow as West Virginia Heroes Day to honor our incredible first responders in the state of West Virginia. You know, it truly is a special day that all of us should sit back and have thanks and appreciation and love towards all those that have stepped up and helped us every day, especially right now in this terrible pandemic that we're fighting. Also tomorrow at 11 a.m. we will broadcast the virtual September 11th, 20th anniversary commemoration ceremony. You know, there'll be speakers from senators and Dr. and Mrs. Ambrose, who lost their son Paul in one of the planes, will speak. General Crane, Kathy, our First Lady, and myself will also speak. I encourage you to watch it. It's, it'll be on my website, social media, and broadcast on TV by West Virginia Public Broadcasting. And so I encourage you to watch it and everything. I think you'll enjoy it. And it is another way of us showing our appreciation to all those that have given so much. It's a really good thing right here. You know, today I'm announcing an additional CDBG Disaster Recovery Grant Award, and it's going to Clay County, to the town of Clay. This project will rehabilitate Clay's sewer facility and will facilitate the ability for new businesses to open in Clay County and to help along with the regional development of the activities along the Elk River. All this is great stuff, and I congratulate them and tickled to death to be able to pass that on to Clay County and to the city of Clay, or to the town of Clay, rather. Okay, the federal infrastructure bill is still kind of wavering back and forth. You know, are we going to pass the federal infrastructure bill? And I want everyone to know exactly where I stand. Without any question, I stand steadfast on the fact that we should absolutely pass the infrastructure bill in the state of by all the folks that are in D.C. That bill will help West Virginia in so many ways. I mean, from the standpoint of broadband, from the standpoint of water and sewer, from the standpoint of hopefully being able for us to finish the Coalfield Expressway, the King Coal Highway, Corridor H, to link us absolutely to the world, to bring more and more and more great opportunity to West Virginia. Without any question, I am rock solid as I can possibly be, that we should pass that. Now, I want everyone to know where I stand on this, on the other thing that's floating around. And I think Nancy Pelosi is holding all this up because she's trying to get through a $3 trillion, package of social spending. And it's probably got so much pork and junk in it, it's unbelievable. And absolutely, I am not for anything to do with just throwing money away in the federal government today. The way I see it, and you know me, I'll always just tell you point blank the truth. The way I see it, the Biden administration has had so many issues that have happened, and they have. I mean, like it or not like it. We all watch what's going on in Afghanistan. We all watch what's going on at our southern borders. We all watch what's going on, do we not? And are we not just baffled beyond belief? And we don't like it. We just plain don't like it. There's so much politics, and the politics aren't any good. There's no question that there's social programs that we can do in this country and make things better. And there's no question that our hearts and everything would want to do those. But what's being asked is this, in my opinion. What's being asked is for our federal government to have $3 trillion that they can just throw out in every direction under the sun and basically assure themselves of a good success in the midterm elections. And we're holding that up. We're holding the infrastructure bill up until we get this social bill through first. It's wrong. It's the wrong thing. We do not need that. We need broadband. We need water and sewage. We need absolutely, we need those projects. We need to finish the Coalfield Expressway and Corridor H. We need to do those things across this nation. Every state has those things. There's no question whatsoever. I am rock solid behind the federal infrastructure bill. I spoke yesterday with Congressman McKinley. He's doing a wonderful job and everything, and I believe that he is wholeheartedly supportive of this bill. But nevertheless, I congratulate him and all those that are working hard every day. They're frustrated. They're frustrated by a lot of the things that they see, just like I would be frustrated, and I am. With all of that, surely to God above, we're not going to hold up an infrastructure bill that could help all of us all across America. We're not going to hold that up for politics to make sure that we get through a $3 trillion bill that absolutely would throw money in every direction and everything to ensure success maybe in the midterm elections. I've got a couple other things, well, just one more thing, and that is Peyton City on the Superfund list. The U.S. Environmental Protection Agency announced that they are proposing to add Peyton City groundwater site to the Superfund National Priorities list. That's great, great news, everyone. I thank the EPA for this decision. We have pushed it, and we have been very hopeful that they would move this way. We referred the site to the EPA for their consideration. They're coming through on this, and it will only make things better and better. It's important to note that Peyton City has been successful in the treatment, their household water supply, but, this listing will further fund the cleanup and ensure the safety of all those folks and everything as we go forward and everything in many ways. And the site consists of groundwater, contamination hazard sites, and all kinds of different things that they're going to work on and everything. So So it's a great, great, great day for Peyton City, and we just got to get it all across the finish line and get the work started and get everything moving. I'm sorry we've been through a lot of announcements and everything, and but I'm done. Thank y'all.
Thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, thank you, and good morning. As the governor said, we are still in the midst of that growth phase of the Delta variant spreading in West Virginia, and we have seen the consequences of this. The consequences are borne largely by people that are not currently vaccinated. As the governor said, our real cornerstone of our approach to save lives and maintain hospital capacity for the long term is to see more people that choose to be vaccinated. As we go forward, the governor also pointed out that we are now seeing as many people in our hospitals as we've seen before. And we've reached that level of hospital bed capacity taken up by people infected with COVID-19 about 100 days quicker than we did during our last surge, which was in December of 2020. And we have seen more people who are in the ICUs and more people needing mechanical ventilators than we've ever seen before. And remember, as recently as the first week in July, we had 52 people in our hospitals. We currently have 818. We had 17 people in our ICUs. We currently have 252. And we had 6 people on ventilators, and we currently have 152. So as we start to look at this particular surge, we know that it's really important for each individual in West Virginia to make sure that you are doing your own best job at protecting yourself and protecting your family. And that cornerstone is full vaccination. And we know that people in the hospital, about 85% of our hospitalized patients are not vaccinated, 90% of our ICU patients not vaccinated, 91 to 93% of our people on ventilators not vaccinated. And the governor's also read more names, and we can see that more West Virginians are dying now. About 6 weeks ago, we were averaging about 6 deaths a week. This week, we are already over 60. So as we continue to try to work together, stay together to reduce the rate of growth and start to come over the top of that inverted V-shaped curve, we note that in West Virginia, we were the fastest rate of growth in the country. We are now 3rd behind Maine and Ohio, and we are the 5th place in the country related to the number of cases per 100,000 population. So while that is perhaps a little bit of good news, we can't be complacent because right now we are still under fire from the Delta variant. The governor talked about the impact of natural immunity in people that have recovered from being previously infected with COVID-19. And while we know that that does count, and there is data suggesting that that can be protective, we also know from the Red Cross that up to 80% of Americans over 16 years old have evidence of reaction to the COVID virus, looking at antibodies directed against the spike protein. And about twice as many Americans, as has been documented, have likely been infected with COVID-19 at some point. Because this Delta variant is so incredibly infectious, really, as we've said, a different disease than we've had before, we know that the combination of native infection and immunization gives people the absolute best protection. And as we look at our hospitals and look at our deaths and look at our ICU patients, we know that the majority of these Americans and West Virginians are not fully vaccinated. So all as we can say about the role of native immunity is we do understand that native immunity does play some protective role, and in some people, perhaps a great protective role, and other people perhaps not as great. And we also know that the vaccines, full vaccination, provides extremely great protection against severe disease, ICU admission, and death. So we are still very strongly advocating full vaccination, even for people that have been previously infected with COVID-19, because our data says that people that are fully vaccinated are protected in a much better way than people that are not. And since the American Red Cross reports that up to 80% of all Americans over 16 has some immune response against COVID, indicating that they've been previously infected, then we know that that level of natural immunity is not sufficient alone to protect people from having severe consequences of COVID-19. I would also really like to congratulate the school districts that have decided to move forward with mitigation strategies in the classroom and masking. And while certainly the governor has been very consistent about the need to keep West Virginia together, and we've done a really good job that way, so therefore we haven't created new mandates for things, it is really important for each of our citizens and for all of our leaders to also be extremely careful, and at an individual basis, certainly, consider not only full vaccination, but right now with the spread of the Delta variant, to maintain other mitigation strategies like wearing face masks if you're indoors, and if you feel sick, get tested, and if you have a cold, stay in, because ultimately it is really up to each of us to protect ourselves, our families, and the state of West Virginia. And as we protect ourselves, we stop creating such a stress on our hospital and healthcare systems. And remember, in countries like Italy that got overwhelmed with COVID-19 and their healthcare systems got overwhelmed, that ultimately it was not only people needing hospitalization or ICU care for COVID, but it was people that needed care for heart attacks and strokes and car accidents that were also not able to be cared about. And in Italy, they started doing some rationing of care. At one point, they were not accepting anybody over 65 to their ICUs. And while we certainly still have capacity in West Virginia, and we're working hand in glove, and General Hoyer, I'm sure, will mention some of the things we're doing, working with the hospital systems to maintain their capacity and supporting them, that we know that states like Idaho and Oregon are currently seeing such stress on their hospital systems that they are starting to do some care rationing in parts of their state. So we want to be smart. We want to continue to protect each other, protect this great state, and staying together, we will make it through this as well. But full vaccination is the cornerstone, and we heavily encourage everybody, even today, even though it won't get us out of this particular surge immediately, that for the longer term, it is so important that all West Virginians consider vaccination. Thank you.
Thank you, Dr. Marsh. Next to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good morning. I'd like to highlight two issues today, or two items today. The governor has continued to task us to expand our availability of antibody treatments, an initiative that we are currently in the process of finalizing and will be rolling out next week with the Primary Care Association, which covers the many clinics across the state of West Virginia and all of our counties, is a plan to expand testing capability at those areas, as well as additional triage support for those who may believe they have COVID and need assistance. And in addition to that, it will expand the availability of the antibody treatments into those facilities as well. This will help do several things. It will get access to triage for West Virginians who need it, but most importantly, it will also help us to relieve some of the pressure across our hospital systems that the governor and Dr. Marsh have pointed out, that we are at a critical juncture in those areas in treatment. The other thing I'd like to point out is, again, as the governor pointed out, good movement in getting to 73.4% of the eligible age population with a first dose. But as the governor pointed out, this is not fast enough. We have got to pick up the pace, West Virginia, and get more people vaccinated. Same as Dr. Marsha has pointed out, while the antibodies are helpful to us, and as the governor said, can save lives, there is no substitute for getting educated and getting the vaccine. And I want to close with an example to reinforce this. 2 nights ago, the governor's leadership team was contacted about helping a West Virginian under the age of 30 get immediate access to an ICU bed. Before we were able to make that happen because of the challenges with ICU beds across the state, that individual succumbed to their COVID disease. I was just informed as we came on the press conference from a friend that individual was actually also the foster parent for 3 young children. So again, to point out the governor's point, 73.4% is good, but it's not fast enough. And we know we've got to get that number as close to 100% as possible, because this is not just impacting us as individuals when we get COVID, it impacts our families and our communities and our entire state and our entire nation. Please get educated and get vaccinated. Thank you.
Thank you, sir. Dr. Ayn Amjad and Secretary Bill Crouch are also joining us today and are available for questions. We'll now go to questions from members of the media. The first today from Charles Young with WV News.
Hi, y'all. This is Charles Young with WV News. Governor, recently we've heard calls from some Republican lawmakers who have talked about wanting to convene a special legislative session in order to pass legislation which would make it illegal for employers, other institutions like universities to make, they wouldn't be able to mandate vaccines. It would require 3/5 of both chambers in order to do that. Doesn't look like there's the consensus as of yet, but they could call that on their own. What are your thoughts on the calls for that special session? And would you support that type of legislation? Thank you, sir.
Well, first of all, I would not support that type of legislation, and the reason that I wouldn't is I just believe just this, that we're talking about intervening in business. I mean, if you just think about it, we're talking about putting a mandate on that a private business couldn't decide on their own what that they wanted to do. Now, I mean, it just seems to me like we have really lost our way. I mean, I always thought that true Republicans stood for letting private business do what they want to do. And now we're trying to impose restrictions on private businesses. I mean, it seems like a complete role reversal. It seems like something that the Democrats would have come up with, years ago, and now the Republicans are just trying to come up and thank goodness, I think at least, that this is only a few, that really have now completely reversed roles. True Republicans really believe in letting private businesses do their own thing. I truly believe that it is not government's place to tell private business what they can do, Now, so Charles, no, I don't support coming in and making mandates against mandates, and so, I absolutely do not. I want to go on a record as saying, what President Biden is doing right now, coming out and saying, well, we're looking at any employer that has more than 100 employees, making it mandatory and everything that they get vaccinated. I absolutely, think that is wrong. I am absolutely not in support of doing that in any way in the state of West Virginia. I am absolutely not supportive of that. And to be further more clear, I would just tell you just this, and this is all there is to it. That we've all watched on TV exactly what's going on with the Biden administration. We've watched it at our southern border. We have watched it in Afghanistan. We have absolutely seen us stumble all over ourselves. And now, we're absolutely grabbing for straws, and we'd say, well, let's hit at our businesses, let's hit at our private folks and everything in every way. No. I think we're going to absolutely, all we're doing is doubling down to try to change the news cycle. That's what this is about. This is just changing the news cycle, to where we will take the attention away from Afghanistan or the southern border or whatever it may be. We will do that in order to just change the news cycle. I do not think that we need to be mandating, that our businesses be, absolutely require people to get vaccinated. I do not think in any way that we, especially as Republicans of all things, it is almost comical to think that Republicans are trying to come up with a way to come up and put restrictions on private businesses. If a private business, if XYZ company out there decides in their mind that they want all their employees vaccinated, and it is the private business's decision to do that, more power to them. But absolutely, to tell that business that they have to do that, or to tell that business that they can't do that, we don't have any business doing that. That's all there is to it. That is not for us to do. And that's how I feel about it. And I'm pretty passionate about it because I think that's right.
All right, thank you, Charles. Next to Mark Curtis with Nexstar Media.
Good morning, Governor and cabinet members. I have two related questions I'd like to ask, one from me and one from a viewer. From me, Governor, you always talk about crossing the finish line. Why don't you or Superintendent Birch or the Board of Education simply order those 4 counties that are dragging their feet to just have the mask mandate that all other 51 counties have? And in a related question to that, I had a viewer write in wondering if some of the American Rescue Plan and CARES Act dollars could be used to retrofit and check all the HVAC units in schools around the state. It occurred to this viewers that we've had mold problems in schools, and that if you put in HEPA filters, you might be able to filter the air better and prevent the spread of not only COVID, but the flu and other airborne illnesses in schools. And I'm wondering what your thoughts are, or anyone else's, on retrofitting some of the schools and improving the ventilation systems.
Mark, let me go to the last part of your question first and everything. There was, and I don't know the exact dollar now, but probably well in excess of $100 million, well in excess of that, that absolutely were given, came from the federal government to our school systems and right here in West Virginia. And I'm sure there's been all kinds of retrofitting and all kinds of things that have been done. Can we do more? Sure. Sure, we can do more. Would we be in favor of doing more? Sure. There's no question about that. From the standpoint of the first part of your question, I have absolutely stood steadfast over, and it's worked. I said, listen, you know what's going on in your schools. You know what's going on in your county. You make the decision on a local level, and we're going to give you that opportunity to be able to do that. Now, we've got 4 counties that are probably dragging their feet some, but they may very well feel that in their county, they absolutely don't need masks. And if they feel that, we're going to honor that, and so, Mark, I do really believe that we've made an incredible investment in our schools, and you can't. It's just like our highways. I mean, you let decades of neglect, happen to our highways, you're not going to fix them all on day one. That's all there is to it. We have put a real priority on our highways, have we not? And everywhere you go, there's orange cones all over the place. And there's roads being paved everywhere you turn. And we have made an incredible improvement, but you're not going to fix them all on day one. That's all there is to it. We've got a lot of money that's been, put into the school systems, and I am absolutely for it. And we're going to continue to try to do everything we can to make the air quality better and better.
All right, thank you, Mark. Next to Evan Bevins with Ogden Newspapers.
Yes, Governor, you made clear your thoughts on the proposed mandates for private businesses by President Biden. But I was wondering, do you have any idea at this point, if that were to go into effect, how many employees in West Virginia and in terms of the requirement for federal employees would be affected by that?
Well, I don't have the number yet. I surely don't have the numbers, but I do not think that that's going to go into effect, and I hope and pray it's not. You know, I'd like to add one more thing, and you know, I was on the call just a few minutes ago with the Republican governors. I didn't get to speak and everything, but you know, I really think this. I really do. I'm really puzzled the direction that we're going on with the Biden administration, and it's embarrassing in lots of ways, and I'm really puzzled with what Nancy Pelosi is trying to do to us, you know, on a $3 trillion spending package, you know, that'll just be throwing money at everything, basically throwing money at everything to get votes in the midterm election, in my opinion. But the other thing I would say on the other side of the aisle is just this. The Republican governors in as a whole believe that people should get vaccinated. But absolutely what I am afraid of is just this, because, you know, in this statement, I am going to sound like a politician or sound like and I don't really like that, or sound like a politician that, you know, that gives you a viewpoint of what I believe. You know, I strongly believe in really conservative values. And I really believe that if we don't watch out across this nation as Republican governors, if we don't really watch out and, you know, and quit putting qualifiers per se with people, you know, being vaccinated, you know, I am absolutely against the mask mandates, and I am absolutely against mandating vaccines, you know, but encouragement of people with no qualifications or with no things, I don't even know exactly the word, but with no qualifiers that would say something like, I believe you should get vaccinated, but it's just your choice, and I believe in this and I believe in that and everything. And they don't wholeheartedly commit to saying, we got to get vaccinated, everybody. You know, let's absolutely stop the nonsense. We got to get vaccinated. Now, we want to be super respectful of everybody's rights. There's no question about that. We absolutely want to treasure our freedoms, and we don't want any overreach of government like Biden is doing right now. We don't want that. But we've got to encourage people as Republican governors, without any question, to go get vaccinated and without qualifiers. Absolutely, we have got to do that. And if we don't watch out, you know, there was an old saying used to be in Sports Illustrated long ago and everything, and it said, you know, to grasp victory right from the jaws of defeat. If we don't watch out as Republican governors, we're going to grasp defeat right from the jaws of victory because of all the craziness that's going on in Washington, and I'm only being honest. The craziness is being led by the Democrats in so many ways. We see it. We see it right now. But yet when we come out and we won't just wholeheartedly say, what are we doing? What are we doing in this country? We have got to get vaccinated. People are dying right and left. Now that doesn't mean we have to mandate anything, but we have got to be the biggest cheerleaders of all to get vaccinated. If we would do that, and we would come out super strongly in encouraging and educating our people to get vaccinated, we win the day. Really, at the end of the day, all we're trying to do is change the news cycle away from Afghanistan or the southern border or whatever it may be, you know. But at the end of the day, if we don't watch out, as Republicans that are trying to do the right things for the right people, for all the people and everything, if we don't watch out and just and get away from qualifiers and just get all on board as trying to be the biggest advocates and cheerleaders that we can possibly be to get vaccinated, we could very well lose the day. And so I've given you a whole mouthful there, and I'm sorry that I've been so long-winded.
All right, thank you, Evan. Next to Paul Mullen with WCBC.
Good morning, Governor. Good morning, panel. A question, Governor. I know that you have been lobbying the federal government to get that booster shot released. What would stop you or the National Guard from distributing booster shots right now and making the Biden administration go to court to stop you from doing that? Wouldn't the optics be bad on their part, because the medicine and the studies are on your side, that you would be trying to save lives? Thank you.
Was this Paul? Paul, to be perfectly honest, I've had a hard time understanding, why not, the why nots, because I'm a person that says, do it and make them sue us, make them show, make us stop. But the problem that we keep running into with the headwind is just one thing. They can stop sending us the shots. And so all of a sudden, what we could get into a situation to where we have a limited supply because we don't have the CDC approval, we don't have the FDA approval, and literally they control the shots. And so that's the problem, Paul. That's the hesitancy and everything. And if we don't have the shots, a bunch of West Virginians will die. There's no question about that. And so, I mean, in this situation, at the end of the day, we got to have the cheese, and they have the cheese, and they got to send it to us. And if we jump out on our own and start doing stuff, and they start cutting us back, or they, whatever it may be, it could really hurt us. And that's why.
All right, thank you, Paul. Next to Kimberly Keggy with WSAZ.
Hi, everyone. Good afternoon, Governor. Thank you for taking some time for our questions this afternoon. I wanted to ask you, you've made yourself very clear that you are not in favor of vaccine mandates pushed down from the Biden administration. And so you have offered several incentives for people to get vaccinated. Is that something you would consider as offering a vaccine incentive for businesses who encourage their employees to get vaccinated and have fully vaccinated staff members? Thank you.
I sure would. I mean, for crying out loud, I'd do anything. I'd do anything as far as encouragement and incentives to be able to get more and more and more people across the finish line. You listened to a general just a minute ago. A general, the General Hoyer saying, we're doing good, but we're not doing good enough. We got to have more and more and more people running to the fire and getting across the finish line. But absolutely, we'll look at it. We'll see if we can figure out how to do it. But I'd be highly in favor of any kind of level of incentives that'll get more and more people across the finish line. When you look at it, when you just think about one thing, just think about just this. Yesterday, I was in front of, and I don't know how many people, the kids were there, but probably, 1,200, 1,500. They were around a gigantic parking lot, and they went all four ways, all the way around the parking lot. I mean, it was unbelievable. And those kids were quiet, and they listened. I had the opportunity yesterday to stand in front of 1,500 or 1,200 kids at one high school, encouraging them in every way to go get tested and be disciples, to tell their parents, to tell their grandmas and granddads and everything, to absolutely go get tested. How did we do that? We did it, do it for Baby Dog. We did it on an incentive program. Will it work? We're seeing it every day. We're seeing it every day, that every day we get a few thousand more, a few thousand more, a few thousand more. Absolutely. Any kind of incentive program that would help us get our businesses to jump in and try to do anything and everything to encourage all their employees to come and get vaccinated, sure, we'll look at it.
All right, thank you, Kimberly. Next to June Leffler with West Virginia Public Broadcasting.
Hello, good afternoon, panel. My question is for the governor. So Mark had a similar question. He put it to you as far as the schools, asking you again if you would potentially mandate a mask requirement across the counties. I'm wondering if the Board of Education came to you with Birch and said, this is something we would like to do. Would you be in support of their decision? Would you work with them, or would you not?
June, I'm not sure I really completely understand your question, but let me make a stab at it. First of all, the boards of education are elected in our state. We've had a bunch of people from Putnam County that have not been happy with the board's decision, and the decision was 5-0. I mean, that's all there is to it. Now, the people elect those people, now, and those people are supposed to be in tune with what's going on in the schools in their county. And therefore, that's why we have absolutely adopted and tried to let them make those decisions. Now, I don't really understand what you're saying about, them whispering to me, if they, they want me to make that decision for them, or, could you clarify that, please?
Sure, thank you. Yeah, so if like the state Board of Education had a vote saying, yes, we want to mandate masks across all 55 counties, would you step in and say, no, we shouldn't do that? Or would you let the Board of Education go on with that, if that is a vote that they came with?
I really don't know exactly how to answer it. They have the power to do exactly just that. And they haven't exercised that power to do exactly just that. But June, I would support, without any question, I would support our state Board of Education. If they come and they say, this is what we want to do, I'll support it.
All right, thank you, June. Governor, I'll turn it back to you.
Okay. I just have made myself a few notes. I'd just like to say that WVU just came out and they're going to require masks in all their buildings, whether you've been vaccinated or not. I think, again, we need to be respectful of that decision. We don't need to be standing back, throwing rocks at each other. Remember just one thing in West Virginia that absolutely is ever so clear to me. We got enough people on the outside of this state that want to throw rocks at West Virginia. We don't need to throw rocks at one another. We're moving in the right direction. We want to continue to move in the right direction and be respectful to everybody's decisions. From the standpoint of, I'd like to say just one more thing, I do not have any idea where the Biden administration is going, but right today, I've said over and over, President Biden is the President of the United States of America, and we need to be respectful to the position. That's all there is to it. But without any question in my mind, I absolutely am completely bewildered by the actions of what we are doing and what we're taking. And this last go-round is an overreach by the federal government beyond belief. It threatens our freedoms and lots of different things about us, and I am absolutely adamantly against it. And so with all of that, I hope to goodness that we get our act together on a national basis from the national administration and our presidency. I mean, the Afghanistan thing was a total embarrassment. What's going on at our southern border is surely not good. we see it everywhere under the sun, and if we don't watch out, we're going to implode ourselves. Now, with that being said, I want to switch channels back to just this. The weather's going to get bad. The weather's going to get bad. We read 38 names today. We lost 38 people. We've got, I don't know what it was, 24,000 people that are active cases today. 24,000 people that are active cases, and more people in the ICU units and more people on the ventilators than we have ever had in our history. A bunch of those people are going to die. We lost 38 today. The weather's going to get bad. When the weather gets bad, what do you think is going to happen? It's going to get worse. It's not going to get better. It's going to get worse. And like it or not like it, I have always just spoken to you and told you the truth. As it gets worse, we're going to have to act. We're going to have to do things that we don't want to do in this state. We're going to have to absolutely start to distance ourselves and not be in gatherings and everything else. We're going to have to do that. Because if we don't do that, and everything, and things get worse. And the only way things are going to get worse is if we continue to not get vaccinated. Without any question, if we go really, really running to the fire and we truly, truly get ourselves vaccinated, we hope and pray things aren't going to get worse. But I'm telling you, without any doubt, the weather's going to get bad. The likelihood that things are going to get worse is surely there, especially if we don't get vaccinated. And the last thing I'd tell you is just this. If things get worse, we're going to overrun our hospitals. Dr. Marsh tells us that over and over. If we overrun our hospitals, the first thing that's going to go out the door is the elective surgeries. The next thing that's going to go out the door is just this. And imagine this. We're not far from this. But imagine a doctor that's going to look at one person and say, I think there's a chance we can save them. Give them an ICU bed. But this person over here is in tough shape, and we don't have enough beds. And so therefore, we don't have an ICU bed for this person. I'm telling you, if you don't get vaccinated in West Virginia, that's the decisions that people will have to make. The weather will get worse. The hospitals will be overcrowded, if not overrun. There will be ICU patients that we will not have a bed, and they'll die. Now, you've got a real choice, West Virginia. To me, all of us, as Republicans or whatever, Republican governors should be advocating that choice. You have got to go get vaccinated, West Virginia, and you've got to go right now. I cannot possibly tell you more bluntly. I am not in favor of a mask mandate. I'm not in favor of what President Biden is doing, as far as mandates across this country or proposing such a thing. I am absolutely in favor of our businesses, private businesses, making their decisions on their own. I mean, for God's sakes, a living, why should we impose either way? Why should we impose things on our private businesses? We're America. America, the greatest country. Absolutely, what we've got to do right here is we got to step up to the plate and say, without any question, whether I like it, I'm in favor of it or not, I got to get myself vaccinated because I got to do my part. I got to do my part as an American for all of us right now. Whether I believe in it or I don't believe in it, I got to do my part. I got to step up. Our governor is trying every way in the world to not mandate anything, to not impose restrictions on our freedoms in any way. But I got to step up. I got to step up right now. I got to step up for all those around me that love me, and I got to step up for all those that I could be in contact with that I don't even know. I got to step up. It's what you got to do. If we don't do that, the weather's going to get bad. And absolutely, we're going to be overrun at our hospitals. And there's going to be decisions that have to be made. Who's going to live and who's going to die? It would be terrible beyond belief. I know you'll make the right decision. I love you with all my soul. West Virginians are the greatest of the greatest, and I really trust you'll make the right decision, but you got to make it quick. Thank you so much.